your anatomy physiology class that you talked about the cranial nerves. Right? Remember that horrible thing and learning all about the cranial nerves? We're going to talk about the cranial nerves here, and we're going to talk about how you test the cranial nerves. Now, what I have done, though, is we're not going to talk about the cranial nerves all at one time. I've got the cranial nerves under each section that they apply to. All right? And then at the end, we'll try to put them all together one more time. But I wanted to make sure, since we're talking about concepts, that our cranial nerves are listed where they belong. All right, does that make sense? All right, so let's do the first one. There we go. So let's talk about visual. What does the word acuity mean? What's the word acuity mean? Sharpness, okay. Small details, the ability to see those small details. So visual acuity is that nice 20/20 vision. Having a 20/20 vision. Well, I don't know about you, but without my contacts, I could not see Hope sitting right here in front of me. Okay? I could see her, but I couldn't see the details in her face or anything. So my vision is pretty bad. My visual acuity is pretty bad. But we are supposed to have 20/20 vision by the age of 6. That is when, so you really should never take your child to the eye doctor unless they're really having difficulty until the age of 6, because that's when they actually should have, their eyes should have developed enough to be 20/20 vision. Okay? This is a sensory nerve. Do you remember the difference between sensory and motor nerves? Maybe kind of, sort of. Somewhere in the back of your brain. It's foggy. It's back there in the cobwebs. Okay. How do we test visual acuity? Remember, there's the eye chart, the E chart, the Snellen chart is what it's called. S-N-E-L-L-E-N, the Snellen chart, and that's that chart with the big E up at the top, and then it gets smaller as we go down. That's the way to test visual acuity. The bad thing, though, is that we don't have E-charts at the hospital. Have you ever seen anybody whipping out an E-chart at the hospital? Nobody does that. So how could you test someone's acuity at the hospital? What could you could hand them things. Like what? Okay. What about those nice wipe-on, wipe-off boards we have, whiteboards in the rooms? Y'all see, have you seen those? Okay, and maybe you write the date up at the top, and then you say, can you tell me what this says? Okay, now it's not going to tell you whether or not it's 2020 or 2015 or whatever, but it's going to tell you how sharp their vision is, whether or not they can actually see that. There are some alterations in visual acuity. Myopia, you know what that means? Nearsighted. Myopia is nearsighted. Hyperopia. That one is? Farsighted. Hyperopia is farsighted. And then something that we can't prevent, just happens. Presbyopia. Happens about the age of 45. We lose the elasticity in the lens and the ability to see things up close. So have you ever seen your parents or grandparents, holding stuff out like this to be able to see it? That's presbyopia. Ability to see things up close. You lose that elasticity in your lens. Okay. That is cranial nerve 2. Now, I don't know how you memorize the cranial nerves in your anatomy class, and I think there's some pretty raunchy methods out there. I don't care how you know it. I learned on old Olympus tolerance off of here in terms of Peter Bob. Did anybody ever learn that way? Some of you like similar. Similar? Okay. And like I said, I know there's a raunchy way out there. I don't care how you, if you know it that way, that's fine. But what that's telling me is that the second one, on is O, that's cranial nerve optic. cranial nerve number 2, which is optic. So that's how you learn the cranial nerves. However you want to do it, that's perfectly fine with me, just so that you'll know how to test it. So we know that we test cranial nerve 2 optic by using the Snellen chart. Now when I'm testing you in a more formal setting, I'm going to have a question like, how would you test cranial nerve 2 optic? And then the A, B, C, and D are going to give you some different ways of testing things, and you're going to pick Snellen chart. So that's how that kind of question is going to go. All right? Does that help?
Yes.
All right. Ocular movement, the ability of the eyes to move up and down and sideways. These are motor nerves. So these are nerves that cause the eyes to move. There are 3 cranial nerves that are involved in this. Cranial nerve 3, which is oculomotor, 4, which is trochlear, and 6, which is abducens. Now, the way we test ocular movement is by Perla. Anybody ever heard of Perla? P-E-R-R-L-A. Okay? Pupils equal round, react to light, and accommodate. Okay. So, I need a volunteer from the audience. All right, somebody get up here. Come on. Somebody. No, come on. Oh. Okay. All right, so we are going to, just face everybody. So we are going to do the Perla test. Oh, tell me what your name is. Tia, on Tia. Tia is going to do the Perla test for us. So go ahead and take your glasses off for a second. Okay, so the first thing we're going to do is we are going to use our pen light, and we are going to see if her pupils are equal. Okay? So we can look to see if they're equal. If you put your hand in between her eyes over her nose, and you draw the light in, it should react to light. Right? And we want to make sure it reacts the same way. And then we want to make sure that she can accommodate. And accommodate is when you, this is always fun to do. You don't have to use your light. I want you to follow my pen in, okay? Okay. Now what happens is that their eyes are going to cross, but also their pupils are going to, what should they do you think? They're going to dilate because they're trying to focus on what's coming at you, what's coming in towards you. So that's called accommodation. The other thing that you're going to do with your pen light is you're going to see whether or not they actually are moving, which is the ocular motor nerves. So these are called the 6 directions of gaze. Okay? The 6 directions of gaze. So you take your pen and you say, without moving your head, I want you to use your eyes and follow the pen. Okay? 2, 3, 4, 5, 6. And you can do 7 and 8 as well. Okay? Thank you, dear. Okay? So those are called the directions of gaze. And what you're doing is you're testing the up and down movement of the eye, the lateral movement of the eye, and the ability for the eye to move diagonally. So you're testing the muscles, the muscle movements of the eye. What kind of patient might have trouble with that? A stroke patient? What other kind of patient might have trouble with? Head trauma. Okay, somebody who's been in a really bad car wreck. Somebody who has lazy eyes. Exactly. Okay. So any of those kinds of things. Glaucoma. Patients who have glaucoma, all your older patients, are going to have trouble with Perla. Their eyes, their pupils are not going to react the same way. All right. So there's a lot of patients that are going to have issues with that. Okay. What is nystagmus? Everybody know what nystagmus is?
Rapid eye.
See that, nystagmus? That's that rapid eye movement when the eyes will jerk. Happens a lot with our seizure patients. Seizure children, they will have that rapid eye movement, nystagmus. What is strabismus? Cross-eyed. Strabismus. Okay. Now, we mentioned glaucoma. Did you know that glaucoma is the most frequent cause of blindness over the age of 40? Yeah, the most frequent cause of blindness over the age of 40. Increased pressure in the eye is what causes glaucoma, and it makes the vision blurry or foggy. And patients who have glaucoma have to put drops in their eyes. Anybody know anybody with glaucoma? No? A couple of you. And you have to put drops in there. They have to put drops in their eyes, and those drops help to decrease the pressure in the eye and hopefully to make the vision clearer so it's not so foggy. The way that you test visual fields, and glaucoma patients are going to be affected with their visual fields, is to ask them when you're checking those 6 directions of gaze, then you say, tell me when you can see my pen. And as you're bringing the pen in, they should be able to see the pen without moving their head. Those are those visual fields. Okay, so you take the pen, you put it behind their head and say, tell me when you can see the pen. Now, it shouldn't be here before they see it, right? If we've got our visual fields are intact, you should be able to see the pen coming at you way back here. Okay? All right.